On the Health Watch, Hall of Fame quarterback Brett Favre made a surprise announcement Tuesday revealing he's been diagnosed with Parkinson's disease.
His diagnosis is sparking conversations and raising questions about the disease. Joining us now to discuss it is Dr. Neepa Patel from Rush University Medical Center. Dr. Patel, thank you for joining us. If we could start, though, with reminding viewers what Parkinson's disease is and what the symptoms are.
So Parkinson's disease is a neurodegenerative condition that develops slowly over time. The most common symptoms are tremors, stiffness, slowness, incoordination, and then walking and balance issues. It's a slowly progressive condition.
There's a lot we don't know about it, right, doctor? I mean, we're not really sure if it's hereditary. We don't really know how it's caused. Brett Favre seemed to link this with his football career, though. Is there a link with concussions or collision sports or head trauma and Parkinson's?
You're right. We're doing a lot of research, and we understand a few key aspects of it. That we do think genetics plays a role, but it's not a definitive, I have the gene, I'm going to get the condition. We know that environmental factors such as trauma to the brain and even certain chemicals like pesticides and other toxins can trigger the genes to activate Parkinson's disease. So there are some research studies that do make an association between traumatic brain injury, head injuries multiple times during football, being linked with a higher incidence of Parkinson's disease. Now, we don't know if that's a cause and effect.
So, doctor, if we talk about ways to perhaps decrease our risk, you talked about the environmental factors and in sports, of course, we're talking about concussions, but is there anything that people can do to decrease the risk for Parkinson's?
Absolutely. Exercise. Research has shown us time and time again that people who exercise aggressively, doing not just cardiovascular, but also stretching, strengthening, whole body work, have a lower incidence of, or have a lower progression of their Parkinsonian symptoms, have less disability. So people should start exercising now just to reduce their risk of neurodegenerative symptoms in the future. Being out in nature, social interactions, having a full life, all reduce the risk of any neurodegenerative disorder, and we also believe that this helps protect against further progression of Parkinson's should somebody be developing it.
Yeah, doctor, my dad had Parkinson's, and so I know that for him it was later onset and it was a little slower progressing, but there are current treatments that have been a lot more effective, at least there were in his case. There was a cocktail he was on that worked quite well.
Absolutely. We have a lot of medications available to us to treat treat the symptoms of Parkinson's. Carbidopa, levodopa, and various formulations are available, and these really do help people live full lives. They're still active. And then we also even have deep brain stimulation in some cases that can really help change symptom control and keep people just living their lives and doing the things that they want to do.
All right. Well, Dr. Patel, thank you so much for your insight and your time.
Thank you.